I'm Tamara Thomas, editor-in-chief of UrbanHealthToday.com, part of the DocWire family of medical news sites, and I want to thank you for tuning in to Urban Health Weekly. Our goal each week is to keep you informed of the latest in health and medical news right from today's headlines. It's time to empower yourself with open conversations about your medical care with news that matters to you. So are you ready? Let's get started. Okay, so this hurts my heart to have to talk about, but Scientific Integrity Watchdog slaps lawsuit on maker of homeopathic pills. Raise your hand if you use homeopathic pills. I'm raising my hand right now.
I'm not sure if I use homeopathic stuff.
Oh my God, I use that stuff all the time. I use oscillococcinum and I use...
Oh, yeah. I've had it, but I haven't used it.
Well.
Did you like it?
We save my comments for after I put you guys on. The Center for Inquiry, or CFI, a nonprofit scientific advocacy group, sued Boiron last week for deceptively marketing its homeopathic products, legal documents show. Boiron is a Pennsylvania-based manufacturer that sells homeopathic treatments, such as oscillococcinum for colds and arnica montana for bruising, for example. The complaint alleges that Boiron sells a plethora of identical treatments that consist of sugar pills and powders, all while claiming that each of the products treats a specific illness or ailment. The organization claimed that Boiron used unfair and deceptive trade practices in violation of the District of Columbia Consumer Protection Procedures Act. Boiron profits massively by deceiving consumers in their time of need, said Nick Little, JD, CFI president and legal counsel in the press release. Boiron knows its products are worthless junk, so they do everything they can to hear the truth in order to offload their snake oil upon the unwitting, the ill-informed, and the vulnerable. Little added, they can't be allowed to get away with it any longer. Oh my goodness. In response to an inquiry from MedPage Today, representatives from Boiron said that the company is unable to comment at this time. Holy moly. I was hoping they were going to say something in their defense.
They said nothing.
They said nothing.
That's their PR person.
Yeah, that's kind of damning in and of itself. I'm a big user. I started using the arnica montana. I had a procedure many, many years ago, and the doctor told me to start taking the arnica montana ahead of the procedure to reduce bruising and swelling and trauma. And I was very surprised that it worked so well. And so all these years, I've continued to rely on Boiron products. I had no idea. You know, it's funny, like during the pandemic, I was using it and so forth, thinking, okay, well, it's going to help at least with my symptoms, and nothing.
Oh, that's interesting.
Yeah, that's why I said, let me save my comment till the end. So I have noticed of late that the products don't seem to, I thought maybe it was just me just relying on it so much, or maybe my symptoms are just so severe. But now I'm thinking maybe not. Maybe there's something to this, that they've just gotten so popular that their reputation just preceded them and they jumped
the shark. They jumped the shark.
Oh my God, yes. So I don't know. What do you guys think?
I remember now that I did use arnica a long time ago, but I only used it briefly and I liked it. That was a long time ago, but I've never used their other products. But they have to.
I've tried a number of their products. I tried the allergy. There was one that was for allergies. That didn't work. There's another one that's for nausea. Didn't work.
Oh,
yeah.
You really tried a plethora.
I really have tried. I believe in the product. So I thought that, if I had success with these, so there may be something to it. I think once upon a time, these were like really good products, and maybe they have been like to save money and to stay, what's the word I'm looking for?
Affordable, competitive,
to stay competitive, that they have just been cutting corners.
Well,
I'm so disappointed. I'm so disappointed.
I mean, are you surprised though?
Yes, I'm surprised. I'm absolutely surprised because I don't expect this kind of behavior from.
Doesn't sound like Lou is surprised.
No, I think in all products,
Well,
you know,
he thinks all of this stuff is snake
no,
oil.
no,
Hokum, snake
absolutely.
oil.
If it's not made by like a big pharma company, it's garbage where he's concerned.
No, that's not true. Well, maybe it is true.
Yeah.
The bigger the better, right? Yeah, the more stocks you have, the better. But in terms of homeopathic, sometimes on the pediatric side, I feel a lot safer. Sometimes doing that. Sometimes if it's an allergy med or something like that. There are certain times when I don't really need a lot, but I need something to get me over, like either it's allergy season or a headache or a mild cold where I don't feel like or some other brand. There I go, naming the brand again.
You feel like that would be overdoing it?
Yeah, I feel that would be overdoing it. I just need something, and I don't really want to start poisoning my body with a lot of chemicals and a lot of stuff. I think the homeopathic stuff is great.
But now they're saying that it's just sugar pills. It's
well,
placebo.
in some instances, I'm very glad they're doing this and taking a look at this because there's very little scientific information. Usually,
and by the way, they've gotten ridiculously expensive over the years too.
Yeah. Usually
Oh.
some grandpa looking person or something on the cover where it looks natural or you got a flower or something. They know how to do their marketing, and either it works or you're working on the placebo effect. But when I'm looking for homeopathic, I'm just looking for a mild something. I'm not looking for something that's going to knock out some evil, germ that I have.
But that's not how homeopathy works. Let me look up the exact homeopathy. Okay, so homeopathy is a pseudoscientific system of alternative medicine. Its practitioners, called homeopaths, believe that a substance that causes symptoms of a disease in healthy people can cure similar symptoms in sick people. This doctrine is called similia similibus curantur, or like cures like.
That's better.
Wow. Anyway, so that's what.
So it's not like a druid with a staff and a cloak walking in the woods and eating granola. It's not like that.
No, not really. But maybe once upon a time it was. But in any event, I was amazed by the results years and years ago. The stuff worked for me years and years ago, and I've just always stuck with the brand.
Because you tend to be brand loyal.
I'm extremely brand loyal. And I don't like to take a bunch of drugs. I like the natural treatments wherever possible. Like if I have a cold, I'll drink lots of cinnamon tea, no honey, that kind of stuff. If I have a sore throat, I'll gargle with, some salt water and some hydrogen peroxide. So that kind of thing is what I do. I don't immediately reach for. Like I remember when I was a kid and my mom kept in the house. When you had a sore throat.
Oh, that spray.
What hurt if I swallow? But that stuff, you spray it and then the second you swallow it, it's done. You still have a sore throat. That didn't work for me. So I grew up like, okay, I don't want these drugs. They don't really work anyway. So when I found homeopathy, I stuck with it. But I just have found, like I read this and now I remember putting my hand over my mouth because oh my goodness. I've been being swindled, allegedly. I mean, it's just absolutely mind-blowing. Well,
you did notice a drop-off in the efficacy, though.
Yes, I did. And I thought it was my imagination. But now that I'm learning about this lawsuit, I'm like, it's all coming back to me. It's like, oh my gosh, maybe that's why this hasn't been working. Maybe that's what this is, allegedly. So we'll see. I'm going to be keeping my eye on this.
I'd be curious to know how that pans out.
Well, these things take years sometimes, but we'll see what happens.
I think it's time to name names and name brands that don't work and do work because, and I'm looking forward to that because there's a tremendous amount of brands out there, and I'm sure that there's some that do work. So let's not lump them all together. That said,
Oh, I'm
you
not
know,
lumping them. They're speaking specifically about a company that whose products I've relied on for many,
Mhm.
many years
mm,
and have spent a lot of money on. So I'm just
Okay.
talking my personal experience.
yeah.
I don't know any other name brand
mhm,
for homeopathy. I always seek these guys out.
Okay.
So I don't know,
Okay.
but they're kind of synonymous with the homeopathy.
Right.
So it's very shocking for me to learn this. Mm, 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 mm. Caveat emptor, that's what I'm gonna say. Let the buyer beware. All right, and now for this week's topic. As we know, this week is Black Maternal Health Week. And I have to tell you the story of a lady, Dr. Shanice Wallace, who in September of 2020 was a healthy 30-year-old physician, 7 months pregnant. A photo from her baby shower shows her beaming, surrounded by pink and purple balloons, standing next to a 5-foot-tall tower of blocks that spelled baby. A month later, at her routine OB-GYN appointment, her blood pressure measured high enough to send her to the hospital. Wallace was admitted and started having sharp stomach pains. She was drenched in sweat. Clinicians at first said it must be a panic attack, her husband said. But when her blood pressure continued to climb and the pain in her belly wouldn't stop, they finally put it together. Wallace's liver had ruptured, a sign she was suffering from preeclampsia, a harbinger for a life-threatening pregnancy complication. Her baby girl was safely delivered by emergency C-section. Over the next couple of days, however, Wallace's condition deteriorated. Her kidneys began to fail. She developed eclampsia and had a seizure. Overnight, she had a brain hemorrhage and died. A chief pediatric resident at a children's hospital in Indianapolis, Wallace knew well the increased risk pregnancy poses for women of color. Black women like her are 3 times more likely to die of causes related to childbirth than white women.
Wow.
Experts say the racial disparity, I know. The racial disparity stems from a confluence of factors, including systemic racism and inequity, bias in medicine, and a lack of health resources. She was an advocate for women that were experiencing this. And for it to be in our house, in our lives, it was not only shocking, it was gut-wrenching, said Anthony Wallace. With the knowledge that we have about preeclampsia and eclampsia now, Shanice should still be here. As the nation recognizes Black Maternal Health Week this week, experts want to keep the stories of women and birthing people at the forefront. They want them to feel supported, their childbearing experiences celebrated and protected, and systems to be improved and held accountable. Wow, what do you guys think?
It's so sad, that little girl without her mom. She didn't get to meet her baby. I mean, it's just awful. But also, she went in as a young woman
And a physician, no less. She
and
went
a
in as a
physician,
physician.
and they thought she was having a panic attack. Is
Wow.
that gaslighting of sorts?
I don't know.
It's hard to read the symptoms.
Yeah, it's really sad that this happened. And
I don't know
again,
how stomach aches equates to a panic attack, but okay.
Yeah,
But that's what they do a lot. This is the medical gaslighting that
That's what I was thinking. It reminded me of that.
It's extremely dismissive. Next week I'm going to be talking to an expert about cultural sensitivity in women's health and competent cultural sensitivity at that. So stay tuned for that. But this just got me to thinking, like, how does cultural sensitivity need to be something that is taught to physicians? Because part of their curriculum, what they're taught is to kind of like follow their instincts, right? Like, why so dismissive? Why not just check? I don't understand. Why not just check? Why dismiss? Is it because, do you think it's because they're tired? Do you think it's because, and it can't just be race. Do you think it's because of hungry? Like what else? What else could it be? I don't want to say it's not race. Obviously, it's race related because it's happening 3 times more to Black women than. But I have to also say that my pregnancy experience was extremely positive. After I had my little one, they have you walk to the bathroom to make sure that you're okay.
Right.
And on my way to the bathroom, I passed out. I didn't even make it to the bathroom. I passed out.
Wow.
Immediately, the last thing I heard before I blacked out was the nurse. She said, "Oh," and she ran and she got me help. And those doctors were all over me like white on rice, testing me every second. And, they wanted to keep me and let the baby go. And I was like, "Are you serious? You're going to keep me and discharge my baby?" And they're like, "Unfortunately, yeah, because we can't release you until we know you're okay." That was my experience. So
wow.
I don't want to say it's race, but there has to be. I don't think that these doctors are all necessarily racist.
Was it the ER? Was it a mistake by the ER?
I don't know. I don't know. I'm just trying to.
Also, did you feel like, postpartum, I felt like those maternal nurses are so, like the maternity nurses are so wonderful. I felt like they were extra, but she was coming in at 7 months. She's coming in at 7 months. She went to the ER. So I don't know if she's getting like not somebody who's specifically mother baby doctor, mother baby. I mean,
that's what it is. I mean,
well, I think it's also female and race related too. I think that's in the mix. And she was at 7 months.
They don't say where she went though. It just says clinicians at first said it must be. Why would
it's not necessarily at like the ER at 2:00 in the morning.
Right. I don't know if that was necessarily what happened. And then if she's a physician, then she has contacts and she has relationship with other physicians, right? Like,
right.
I'm just trying to wrap my mind around what really is going on here. I'm not dismissing the racism. I'm saying it can't just be that. Like, what is going on in these physicians' minds and their lives that they're taking the path of least resistance?
Is it because she's a young woman and it was doing that thing again where this is a young woman who is in the prime of life and it can't be, it can't be something really complex?
I don't understand when her blood pressure started rising, why her obgyn didn't take necessary steps. I just don't know. I don't know. This was at her routine obgyn appointment.
Oh.
Yeah. So this was her clinician, I think.
Wow.
This doesn't have enough details, but I'm just trying to figure out what could have happened. What fell apart here? What is going on with these providers that they're missing the mark here? I mean, it could be because she's young, but isn't there a certain amount of like when she's pregnant, we want to save the baby at all costs? I don't understand what's missing here.
Wow. And what was the number again for Black mothers?
3 times the rate of white mothers.
Wow.
Logic would
But
tell
even
you.
women, even Serena Williams, as wealthy as she is,
I remember that.
had to insist because she knew she had
she knew her condition. She knew her body.
Right. And she had to insist. They tried to dismiss her and she insisted that they get medical attention for her right away. Otherwise she'd be dead.
Wow.
And I think Beyonce had a similar situation. I'm not sure which of her pregnancies, but she talked about having a situation where she wasn't exactly. And these are Black women in the upper echelons of healthcare, still having
with presumably the best healthcare.
Exactly. That's my point. So, what is it? What is going on? What do you think, Lou?
On one side, maybe the left side of my brain says that, when you go into these situations, they're pretty much color neutral. You just go in, they treat you, blah, blah, blah. Anytime I've been in that type of situation, which is not, hasn't been often, but I've been there, it's, I felt that, everybody was getting the same type of treatment regardless of race. And in fact, a lot of the nurses and doctors were of color in that in the NICU and all of those areas. Then again,
that might make a difference too. That was my situation. I was surrounded by, the midwife was not, she was not white, she was Jewish.
Mhm.
but everyone else they were all people of color. The
Mhm.
doctors, the nurses. I was surrounded by people of color. Is that the difference?
Do you think that a person is more able to recognize a crisis in a person of their same race?
Well, the doctor was not the same race. He was Asian,
Okay.
but he was insistent that I'm not leaving until he knows that I'm okay.
Okay.
Even though I tried to reason with him that that's ridiculous, he was adamant. He was like, I'm sorry, but we can't discharge you until we know you're okay. Which is what you want. You want someone to say, I need to make sure, damn it, you're not going to die on my watch.
Right. Right.
And so I'm just wondering, like, what is that the difference? Is it that we should, but then there are not enough Black doctors. So what do we do? What do we do with the doctors that we do have? Is it our job to teach them? Like, I mean, you would think she was a doctor. She was a doctor.
You would think she has access. Granted, she's a young woman. Do you think it's also because she's a young, healthy woman? And like in your situation, you're a young, healthy woman, but you just had a baby and you went to faint. So that's like very definitive. You're losing consciousness. She's sweating. She's still conscious.
But she was
Serena Williams.
She was complaining of
Yeah.
stomach pain.
Oh, geez.
Yeah.
And Serena Williams, I mean, she looks like the fortitude. I mean, she just looks like she's the greatest athlete, so you would assume that she's, maybe they're just like, oh no, she's
Right. That's
she's
what
so
they
healthy.
probably thought. Exactly. Right. They thought, well, she's an elite athlete. There's nothing wrong with her. But she knew she had a history of blood clots.
Right. So she hadn't been informed, like she knew her history. So she had to really fight herself.
Right, exactly. And if she didn't know that, and if she didn't fight,
Wouldn't be here.
and insist that she get the doctor in now, she'd probably not be here. That's right.
But maybe that has something to do with it. The fact that, sometimes, people that of color or that are low income don't feel entitled to speak up for themselves.
She's not low income. She's a physician.
I don't know about this.
She was a young woman, though. She might be like just recently post, how long she been a physician for?
Well, she at least 5 years.
30. All right.
My feeling is that physicians are always getting like the best treatment because they're physicians. I mean,
right. And it's sort of like, it's it's instant familiarity with the staff. They want to.
There's no data there, but you would think like they take
One
care
would
of their
think,
own.
but on the flip side of that, could it be an implicit trust? Like, well, I would want to be trusted for my advice, so I'm going to trust this physician whose care I'm in.
Ah.
Do you know what I'm saying? Like there's this thing among physicians sometimes, like I'm the physician and I know what's best. And I want you to follow my advice. And if you don't follow my advice, then you're not a compliant patient and I can't help you. And maybe she's just bought into that because she's a physician herself.
So she wanted to show perhaps respect for another physician.
Deferential treatment to a colleague, yes. I mean, I don't know. Because in order for us to really tackle this, we have to understand what is going on that's causing these physicians to make these decisions that are costing people, particularly women of color, their lives.
Wow.
I mean, I just don't know. I'm trying to wrap my mind around it. Because of all people, she should have survived this.
Yeah, you would think she would have access to everything, and she was with her clinician.
This is why you have to be the squeaky ass wheel. You have to, I don't care if it's a splinter. Make sure that they show you that splinter. Always, always, always be fighting for yourself. You have to. It's imperative. I can't stress this enough. Sometimes you're not in a position to. then you've got to empower somebody to make that, to fight this fight for you. And don't be timid about it. Don't think that these doctors are above you. They're not above you. They are here to serve you. You must remember that. And you must always keep that in mind in any interaction. Just like you go to the restaurant and you place your order and you order your food and your food didn't come back right and you send it back out. You have to treat this the same way. They're not gods and goddesses, people, okay? It is so, so crucial that you fight this out with them. Don't just accept the first thing. You know your body better than anybody else. You mustn't allow them to dismiss you. It took me a week
Yes.
to get a hold of just one doctor, and I got 2 doctors, okay?
You were persistent.
You have to persist if you're going to exist. Don't let yourself be wiped off the face of this earth by fear. You've got to fight. I can't stress this enough. I think that's what it's got to be. It's got to be either you've got to empower yourself and find it somewhere in yourself to fight back what they're saying, or empower somebody to do it for you. But you've got to have these conversations with somebody, not when you're in a crisis, but before you're in a crisis, so that when the crisis strikes, you're ready. She didn't expect this to happen to her, but it did.
Yeah.
And I'm telling you that you have got to speak up. You've got to speak up, because nobody knows your body better than you. So don't, you know what, if the doctor says, well, it's probably just anxiety. No, I don't think so. Why do you think that? Why do you think it's anxiety? Based on what? Can you show me where that's documented? Why can't you just do the test? I had someone, was telling me about her experience with a doctor. The doctor didn't want to give her a particular medication that she had researched and thought might be good for her to try for her condition. It was fibromyalgia. And she said, look, why not just give it to me and I'll try it for 30 days. And if it doesn't work, then we'll go back to the drawing board, but just give it to me. Just give it to me. And I told her that was excellent that she did that, because that's what you've got to do. You've got to learn to negotiate. You've got to learn to volley back. You've got to have those conversations, period. Because if you don't, your light will be extinguished for no other reason than you were silent.
Strong words.
And words to live by.
Words to live by, absolutely.
All right, guys, you guys are killing me.
No, hey, look, the life you save might be your own. I mean, we can talk a lot of cliches over here, but it's absolutely very important. You know, some of these stories, the one thread they have, the people that made it made a big fuss of making sure their healthcare.
Yes,
the patient is the most important person in the room. There it is.
And you have to remember that. You can't just, and I go back to, the idea of women always thinking that, oh, I don't want to be a fuss. Well, I don't want to be a bother. Be a fuss. Be a bother.
That's
otherwise,
good.
You're not gonna get the squeaky wheel.
Now's the time. Yes. The squeaky wheel.
Got to be that squeaky wheel. It doesn't, you know what? Whoever these people are whose feelings you're hurt, it's okay. They're gonna go on. You're the one that has to live with the decisions. So you can't let them make your decisions for you. You've got to make your decisions. You've got to corral these people who are in charge of your health and point them in the right direction. I'm urging you. If it can happen to this young woman, it can happen to you. Please, I'm begging you for your own life. Now, remember, you only have one life and one body. So you got to do your best to make it count so your years are full of life and full of health. Remember, people, information equals transformation. So small steps each day and you'll see a difference. I am sure of it. That's all the time we have today. You guys are lovely, lovely, lovely as always.
Mwah.
Mwah. And I'll see you next week. I know you're not. Bye.
Bye.
Bye, guys.
Thanks for listening to Urban Health Weekly today. I hope you'll join me and my friends next week so you can stay informed and inspired to take control of your health. See you next time.